Mohamed Ziara is a surgeon in a hospital in Gaza, and I asked him earlier on about the conditions where he is.
Actually, it is nearly, it's collapsing. And to tell you something, before the war started and the whole situation comes to this, there was, the health system was already on its knees. And it was like suffering from the siege and lack of, medical aids and the capability to run the hospital in the ideal or the optimal situation. So after destroying and evacuating many hospitals, it's hard to imagine the MOH without these main hospitals. This medical system or the healthcare system is now maybe capable of providing only primary health care now. And to add it to this, the fuel and the electricity, the medical aid shortage, it's all adding a big burden on the health system. And besides, that every hospital in Gaza was taken as a shelter for many refugees. If you see any corridor inside the hospital, you wouldn't believe this is a hospital. These all corridors are filled with people, refugees, children running, and they are making some tents inside the hospital corridors. So with the demands of these refugees and the affection of these refugees to the health system, the patients, it is so unimaginable, actually.
We hear all these different emergencies that you have in Gaza: food supplies, medical supplies, water, the continued bombardment, the ground fighting, all these different issues. If you had one wish, Dr. Ziara, what would be your top priority? What would be your first wish?
Well, it's surely it's been talking about, it's been said several times. Ceasefire is the only option that we have, the only mercy we have, we can have to work in here. I mean, ongoing bombing and firing is not helpful, is not like we can't work under that, even if we have everything else, even if we have the medical aid we need, because we can't reach the hospital if we have bombing, even if there is medical aids and food. The patients and the families are so worried and starting to evacuating the hospital because of the near bombing and near fighting. A lot of my patients flee of the hospital away because they are afraid of the siege, the concurrent and the repeated siege of the hospital. So I mean, nothing will help us but to stop the bombing, stop the firing, stop the attacking. We already have a big burden here and a lot of patient lists that are waiting. But to have more than this, it's completely unbearable and unimaginable.